Now, these are your three medical plans being offered to you by Aetna. Aetna is the name of the carrier. However, it's going to be important to note the name of your specific network. As you can see, the network's name is here and it's the same on all three plans. So if you do have a doctor or a provider and you're hoping to seek coverage by them, you don't want to call and say, I have Aetna. Will you take my insurance? Because they could take a portion of your insurance, but be out of this network. In order to drive costs down, you'd want to ask them if they're a participating provider in this network. Now, there's a lot of information on these plans. I'm going to make it real simple for you. So what's the same on all three plans? When you seek out right here, preventative care, which includes your annual physical, any annual blood work, preventative screening that is appropriate for your age and gender, it is covered at 100% when staying in network. And I would advise you to use that terminology when you do call for that appointment so that it is coded correctly and you won't be charged for that service. Now, one thing to note, if you are adding a young child onto the plan as a dependent, if they're a baby in the first 12 months, their wellness exams include 7 exams. So the seven first exams in the first 12 months of their life is covered at 100%. From the age of 13 months through 24 months, they'll have 3 exams. 25 months through 36 months, it's 3 exams that are covered. And then from age 3 all the way till 22, they as well will have that annual exam. So it's nice to know when they're young, they do have more exams that are considered covered wellness exams. And that is applicable to all three plans. So when you look at this page, there are roughly 2 ways that you will pay for a service. You're either going to see something that says copay or deductible plus coinsurance. So I'm going to start with deductible plus coinsurance, and I'm going to use this first plan as an example. As you can see on all three plans, there are a lot of services that have indeed that word deductible. Now, there's more services that these plans cover. We like to just take a snippet so that you do know how the plans work. So, for example, if you sign up for this first plan and you were to seek out a specialist, and you can see there's a copay, but you have to meet your deductible first. So, what does that mean? When seeking out service with the word deductible attached to it, when staying in network, you would be paying a reduced negotiated contracted rate for that service. So anytime you were to make payment for that service, that money tracks towards the same spot. And that is your deductible bucket. So as you can see up on this first plan, the top number reflects if you're signing up employee only, whereas the bottom number is adding dependents. And you can see those differences on all three plans. Now, some folks go throughout their health journey throughout the calendar year and they never meet or reach their deductible, and that's okay. If you were to be out of pocket, using this first plan as an example, $6,500 employee only, imagine a wall knocking down. You then go on to phase two. Phase two is right here. It's called coinsurance. Coinsurance is a cost sharing between you and the insurance company. So if you were to seek out another service, for example, I'll select outpatient surgery just for the example. Once you've met your deductible, now you would only be responsible for paying 30% of that reduced and negotiated rate, whereas Aetna is paying 70%. So you never want to hit your deductible, but the good news is if you do, your bills now have significantly lowered. Your third phase, worst case scenario, is right here, and this is your out-of-pocket maximum. So the top number is $7,900, and the bottom number is adding members. And you can see on the middle plan that out-of-pocket is lower, and in this buy-up plan, it's even lower yet. The good news is if you were to be out of pocket that amount of money, health covered services thereafter when staying in network are covered at 100%. So they do have a limit as to what you are expected to pay. And that's roughly how anything that says the word deductible or coinsurance works. The other way you'll pay for a service is a flat copay. A copayment is a fixed flat dollar amount that you are expected to pay at the time of service. I often say, imagine it like a ticket that you pay to go back to see the doctor. Some people love copayment plans. The reason being is because they know exactly what they're going to pay at that time of service. So as you can see, if you're seeking out a primary care physician on all three of these plans, it's going to be a flat copay. When you make a copayment, it doesn't track towards your deductible. It goes into the bucket that matters, that out-of-pocket maximum bucket. Again, this is when seeking out care in network. Now, comparatively, I'm going to jump down to the bottom to show you that you do have out-of-network coverage on all three of these plans. However, these are PPOs, so that's great to know. However, once you step out of any network, so no matter who your medical coverage is, if you have out of network coverage, the moment you step out of network, that bucket of money, that deductible bucket and that out of pocket maximum bucket starts over at zero. Those amounts do not track together, meaning any money you spend in network does not get combined with your out of network buckets. So for example, I'll use this buy-up plan. Your most you could spend out of pocket in this particular network is $6,000. Whereas as soon as you step out of network, now that bucket can hold $20,000. So those buckets are quite larger. So it's quite expensive to try to fill your in-network bucket and your out-of-network bucket, as those do not combine. And that is true for all in and out-of-network coverage. In addition, out-of-network physicians do not offer you those reduced and negotiated contracted rate. Remember that doctor that might take your insurance but not be in network? So oftentimes they have to charge you more because they're not contracted through Aetna. And so you are responsible for that balance. Now, the great thing to know on all three of these plans, if you do have a medical need to seek out of network care for a doctor, the great news is you will have that option. But to drive those costs down when you can, find an in-network provider. And in a moment, I will show you how to do that. Now, one other thing I want to be mindful of in explaining is that you do have prescription drug coverage on all three of these plans. If you are on a monthly medication, I'll show you how to create a member portal. You would go to your pharmacy tab, type in the name of the prescription, and it's going to place your medication into a tier, which you can see reflective here. Whatever tier your medication falls under would be the copayment that you would be responsible for paying when picking up that prescription. Now, be mindful that if you are on this first plan, the first money out of your pocket, I'm going to zoom out so you can see it, does track towards that deductible. If you don't hit that deductible, that's how you would be paying for those prescriptions when picking them up. However, if you do meet that deductible, then you would go into a straight copayment. The middle and high plan is direct copayments as soon as you were to pick up that prescription. It's important to note of getting that prescription filled at an in-network pharmacy. Talk to your doctor. If generic is in your best medical interest, that is one way to drive down cost, as well as getting something written in a 90-day supply. And if you want to pause this recording, you can zoom in and take a look at what you are expected to pay out of your premiums when electing these any of these medical plans. Now, this is a great page because this is where you would sign up for that member portal. And as you can see on this flip book, it's activated, so it takes you right to the site. If you are not registered, you would just click login here, and I can show you that this is where you would register. You're able to register once your plan goes into effect. So I highly recommend you doing that because by having a member portal, all your information is housed in one area. How to find those in-network providers. If you happen to lose your ID card, you can get a replacement. Not only is all your information housed there, there are wonderful benefits by being an Aetna member. As you can see, one of the things here is there's an informed health line. If you're seeking out a second opinion or just want to ask a question, of a registered nurse, this is something that is free for you if you're on the medical plans. So know that this is available 24 hours a day. As well as you guys are lucky because you also have a fitness discount program that's attached to your medical plan. By clicking on this website here, it'll take you to the site where you can see what type of facilities are available to you in your area. I think this is wonderful. I wish I could take advantage of this. You also have a weight management program attached to your medical. So there's a lot of great benefits. I would encourage you to get onto that member portal and look around so you can really dig deep into the resources that are being offered to you. And again, how to find those in-network providers is going to be an easier way when having that member portal. Now, a great way to save money is through these cost-saving tools. I did mention that on all three medical plans, you do have prescription drug coverage. However, specifically on that first plan, remember you have to meet that deductible before you go into a straight copay. GoodRx and Single Care are free websites that can save you money. My daughters and I, years ago, we were on a plan similar to your first plan, and my youngest received a one-off prescription, and I went to have it filled at Walgreens, and it was going to cost over $80 to have filled. The pharmacy tech mentioned GoodRx, and the way it works, you type the prescription in, and not only will it show you the different pharmacies that prescription is available, it'll also show you the cost associated in picking it up. For us, it was $13. So that's the route that I took. So it can save you money. It does not track towards your deductible, nor does it track towards your out of pocket. But if it's a one-off prescription, you might want to consider that route because it could save you money. Along with different pharmacies have different discount programs. So I live in Florida and we have a grocery store called Publix. For years, if you had a prescription for an antibiotic, you could go to Publix and get it filled for free, a generic version of it. Different pharmacies offer different discount programs for different medications. Sometimes they're free, sometimes they're, as you can see, as low as $4. So this is your skin in the game. And what I mean by that is where you have that prescription filled is an opportunity to save money. Now down here, I just like to encourage you to create a roadmap. Where will you go if you're not feeling well? Of course, you have this informed health line that I mentioned. That's free through your medical, seeking out care through your primary care physician. These are always going to be at your lowest cost. If you were to need urgent care, make sure you're going to an in-network facility. And it is a good idea to have a general idea as to where those in-network facilities are, because if you're not feeling well, that's not the time to figure it out. Now, if it's an emergency, that's going to be at your highest cost, but make sure you're seeking that care out at an in-network facility as well.